I'm George Kroumpouzos, the Medical Director of a Dermatology and Aesthetics practice in Massachusetts. I also serve as Clinical Associate Professor of Dermatology at Brown University. I'm the leading author of a paper recently published in JMIR Dermatology. The paper is titled Exploring Non-Response to Botulinum Toxin in Aesthetics, a review of key trigger factors and effective management strategies. Why botulinum toxin non-response is becoming more relevant in aesthetics? Because patients receive lifelong treatments. Patients tend to start botulinum toxin injections earlier in life. And because larger botulinum toxin doses are used in some applications, such as the body injections. In our paper, we discuss the mechanisms of secondary non-response, especially those relevant to the toxin and the procedure. Neutralizing antibody formation against the toxin is believed to be an important, perhaps the most important mechanism of non-response, and a high rate of neutralizing antibodies is noted in those individuals experiencing secondary non-response. The rate of neutralizing antibody development and clinical resistance depend on the botulinum toxin formulation, particularly its protein content, specifically the complexing accessory proteins. There have been no neutralizing antibodies with incobotulinum toxin and daxibotulinum toxin. Therefore, these are the least immunogenic formulations. Resistance is more likely to develop when injections are administered less than 3 months apart, when higher dosages or cumulative dosages are used, and when booster injections are performed. In the paper, we discuss the management and prevention of non-response. To conclude, non-response to aesthetic botulinum toxin type A injections is increasingly relevant. Preventing secondary non-response is crucial, and when choosing a botulinum toxin type A formulation, one should consider the potential for immunogenicity. Lastly, we chose to submit our paper to JMIR Dermatology because this journal publishes innovations in digital health, clinical dermatology, and aesthetics. Having published several articles in JMIR Dermatology, I can confidently state that the journal's comprehensive manuscript review process guarantees the high quality of the articles it publishes. I have had a positive experience with JMIR Dermatology and plan to continue submitting my work to the journal. Thank you.